Hello, my name is Matthew Butler and I am the Connecting Communities Lead for Renew in Hull. Today I have come to the studio to invite a former service user of ours, Nicky Purawec, and also Dr. Eyo Bassey, who is our Consultant Psychiatrist in Addictions, to come together and discuss some of the common misconceptions of what methadone and methadone treatment is.
The more methadone I'm on, the more money Renew make.
Actually, that's not the case. Renew is a non-statutory organization commissioned by the local health authority in Hull to provide specialist addiction treatment for patients, and we work by the same principles of the National Health Service, in that we do not receive any direct payments for any treatment or medications we prescribe.
The higher the dose of methadone, the harder it is to come off.
This is a common theme that is heard or can be heard from service users due to their experiences of being in treatment. However, I must make the point that each person's treatment is individual and should be through different stages. Guidelines clearly show that it is essential that patients are treated on the right dose of medication, be it methadone or buprenorphine, which we also prescribe within the Renew service in Hull. And once patients and service users attain a suitable dose to help them become abstinent from illicit opiates and heroin, then we can, in agreement with them, gradually begin the process whereby they reduce from methadone.
I don't want to increase my methadone because it gets in your bones and turns them green and makes them ache.
It appears that the sensation which some service users describe as bone pain is actually as a result of being on suboptimal doses of methadone or buprenorphine. When I say suboptimal, I mean that they are lower doses than they actually need. And so what they're actually experiencing is opiate withdrawal symptoms, or as many people will understand, rattle. So actually, when it's described that someone is experiencing bone pain, it is more likely that is because they are not on sufficient dose of medication to prevent withdrawals or rattle. There is clear evidence that methadone does not affect the skeletal system or bones in any form, and so I would recommend that patients need to be on a suitable dose of medication to prevent them from experiencing withdrawal symptoms or rattling, which is probably the case in these situations.
Coming off methadone is much harder than coming off of heroin.
This is, again, something that we hear frequently in our practice from service users, as unfortunately most service users might have had an experience on one occasion or another when they might have missed doses of methadone or buprenorphine and had to go a few days without the medication. And obviously in those circumstances where someone suddenly against what they've planned, they've had to discontinue the medication, they can experience serious withdrawal symptoms or a lot of rattle. The other thing to take into consideration is that methadone lasts in the body longer than heroin does. And so when you are coming off methadone, when you're rattling from methadone, it could be that the experience lasts longer than it would be if you were coming off heroin.
Methadone can damage an unborn child.
Again, this is contrary to the evidence available, which shows that opiate medication assisted treatment, by that I mean treatment on methadone, obviously some patients would be on buprenorphine or Espronol instead, is the recommendation during pregnancy. It is known that pregnancy can be a very difficult time for service users, in that essentially pregnancy in itself is difficult due to all the hormonal and physiological changes the body is going through, but also someone that is experiencing opiate dependency problems, it could be a very, very difficult time in terms of managing the symptoms they experience. In one sense, the symptoms of pregnancy can simulate symptoms of rattling, opiate withdrawals, so it does need a lot of assertive and intensive input in order to manage all that might occur during pregnancy.
You're not actually in recovery if you're on methadone?
There is no one specific definition of recovery. I believe, as everyone else would have their view on the matter, that recovery is individual and each person has their own understanding of what it means for them.
Entering methadone treatment is just basically trading one addiction for another.
In the past, we talked about opiate substitute treatments, which, as the words go, seem to be substituting heroin for methadone. However, the current guidelines around opiate medication-assisted treatment emphasize the importance of pharmacological interventions as one of the means of helping patients progress towards abstinence and other forms of recovery. Therefore, the way that methadone is prescribed during this form of treatments is not as a substitute per se, but as a medication to help patients gradually achieve abstinence, and hopefully in time service users would be able to come off the medication.
I'm not able to drive if I'm taking methadone.
This is not accurate. There is no legislation that prevents individuals from driving because they are prescribed or they are on methadone.